Hello, everyone. My name is Tashoy Wallace, and I'm currently enrolled in the BSN to DNP program. I currently work at Northside Atlanta in the ICU, as well as Emory's Ortho and Spine Hospital. I've been a nurse for 11 years, and I am in the acute care tract. I chose the topic of HIV because I'm doing my practicum, or I did my practicum, my first practicum, in Emory's HIV infectious disease clinic. While there, I was able to interview the population and the staff members about the disparities and inequalities and the feelings of the patients who are infected with HIV. Some of the patients were very forthcoming with their status and how they received the status, and some were very shy and embarrassed to talk about it. So I decided to explore further the research ethics and healthcare ethics in considering HIV and AIDS. A lot of times there is a stigma and discrimination with having an HIV positive status. We've come a long way in healthcare and in society in talking about HIV and AIDS. In the past, it was something that was not freely spoken about, or it wasn't spoken about in public. And now we're at a point where we at least whisper about it. As nurses, we may be giving report and we will say he or she has HIV. However, in order to change the quality of care and the stigma and the discrimination of the status, we need to now speak freely without stereotypes and without having our patients feel as though they did something immoral or they're sinful. And so that's what my paper basically explored. Stigma and discrimination that these patients face can be from healthcare providers, other entities within healthcare, society, their families, within their own cultures and traditions, and religion. Sometimes their HIV infection came from homosexuality or IV drug use, and it can be looked at or viewed in society as an immoral behavior or a sinful disease. And we need to change that stigma in order to care for our patients and allow for a better satisfaction and quality of life. That way, these patients will decide to come forward with their results, confront any issues or feelings they may have with it and seek treatment. The number one priority is for them to come in early, seek treatment, and get on antiretroviral therapy and get psychosocial therapy as well to help them cope with the diagnosis. The research portion in ethical perspectives when dealing with HIV and AIDS patients include informed consent, and now we're seeing some states no longer require informed consent for HIV testing. That has brought about ethical controversy in, let's say, women who no longer know or may not be, thoroughly informed that they're going to have HIV testing during pregnancy. This is a big ethical issue for this population because not only are they pregnant, well, they may turn out to have HIV positive status. This can cause a lot of social harm for this population and emotional distress as well. Many women who find out that they're HIV positive during pregnancy may lose spousal support. They're susceptible to domestic abuse and domestic violence. So it's very important that as healthcare providers, we are careful in implementing things without informed consent, especially something as sensitive and touchy or risky, let's say, as HIV testing. Another issue in research with HIV and research in HIV is their safety. A lot of times, different mechanisms and procedures may cause more harm to the patient than good. And it's important that not only the institutional review boards, but also researchers take the time to review the harm versus benefits of research studies. It's also important that patients are thoroughly, given the opportunity to have informed decision-making abilities. So if you're going to do research on a population such as HIV and AIDS, it's very important that they're informed of the risk, the harms, the benefits, foreseeable situations, and that we address this head on, completely open and honest and transparent with these patients. Those are the main research ethical issues when it comes to the HIV population. And definitely the key, one of, if not the most important aspect of research ethical considerations in HIV is maintaining their privacy and their confidentiality. It is very important, not only to the individual, but to the community, to know that if they do volunteer and participate in research, they can trust that healthcare providers will be responsible with their health information and maintaining their confidentiality and privacy of their status. It is very important that in using electronic health information that we are secure with our passwords, we are secure with covering and closing screens, and making sure that during the studies we protect their information and their identity as much as possible. It is imperative that we think about the patient and how they would feel if their status got out and they didn't want it to, or sensitive health information got out unnecessarily. That could cause them a lot of distress. And not only will it cause them a lot of distress, it will also cause them to not trust healthcare providers and not trust, being a part of research for further research down the line. So that's also important, that we definitely look at their privacy, maintain and respect their privacy, and earn their trust by keeping their information confidential. One of the aspects of healthcare with caring for HIV patients that I recently got to experience with doing my clinicals in the infectious disease clinic was trying my best, or making sure that I don't pass judgment. A lot of times they're already stereotyped, and they already feel exiled and shunned from society, or shunned in healthcare, or even from their family members. It's important that we don't classify them differently than we would any other patients. For example, I work in the ICU, and we may have a phlebotomist come draw blood. Well, as healthcare providers, we should use the proper, protective equipment for every patient. Gloves, gown, mask, whatever it is that you need to care for that patient, you should use. Well, a lot of times in the past, we have been a little more insensitive about going about caring for our HIV positive patients. For instance, someone goes to draw blood on your patient, and you say, be careful, he or she has HIV. Well, that's insensitive. That's insensitive. Everyone should be treated the same. You should be careful when drawing blood on anyone. You should treat all bloody infection, bodily fluids as possibly infectious. Things of that nature. So it's the same thing in the clinic. I noticed that we would have patients come in who do have HIV. Some would have HIV, some would have Hep C, or different infectious processes. And those who would have HIV, they would feel you could tell they were more uncomfortable with being in the clinic or being seen or being in an infectious disease clinic. And oftentimes it's our responsibility to make them feel as comfortable as possible, and knowing that we're not here to judge. We're here to treat them. We're here to care for them and make them, feel accepted in healthcare, and let them know that regardless of their status, regardless of the infection, we're going to treat them as we would anyone else. It's important that we relate to their ethical feelings and sensitivity. Put yourself in their shoes. Try to encompass a more moral and ethical treatment or practice in your care. It is also really important that they do get therapy to change their sexual behaviors or negative behaviors and practices such as IV drug use and things of that nature. It's important that we take a holistic approach when caring for these patients. Yes, antiretroviral drugs will be prescribed, and it's definitely necessary in order to keep that CD4 levels down and that viral load down so they can be undetected. However, it's still just as important to provide psychosocial therapy, behavioral therapy to reduce the spread and improve the quality of life of those patients living with HIV and AIDS. This topic for me, it was really interesting. I took my time in trying to interview as much, people as I could in the office. And I wanted to understand the barriers to healthcare, the considerations. I wanted to understand the phases that they went through, from being diagnosed to accepting the diagnosis, to seeking help and treatment, to being on a treatment regimen, managing their health, and continuing their care. I definitely learned a lot this past semester in my practicum working with this population, and I have a newfound respect for those patients who advocate for HIV and AIDS and the improvement in the equality of treatment and care for these patients. It is definitely important that as nurses and healthcare providers, we allow ourselves to understand and become ethically competent when caring for these patients. I even got an offer in the infectious disease clinic when I'm finished that there's a position there for me if I would like, and I'm interested in that. I'm definitely interested in the population and research and learning about the different treatment regimens and psychosocial therapies, and I'm glad I had this experience. I want to thank you all for listening. Thank you so much. Sorry about the beeps and buzzes. This semester has definitely been interesting, to say the least. Thank you guys so much. I wish you guys all the best, and see you next semester. Thank you guys.